All right, today we're going to dive into a story about a hidden part of your body, a part you probably never even think about, and the incredible, sometimes really strange, and occasionally dangerous ways it fights back when it's in trouble. So let's just jump right in. We're going to explore the fascinating defense systems of our internal plumbing. We're talking specifically about this little tube called the ureter, and what happens when it's forced to fight a battle it just can't escape. Okay, so first things first, let's meet the hero of our story. The ureter. It is truly one of the unsung heroes of your urinary system. It's a pretty simple but absolutely vital tube. Its whole job is to ferry urine from the kidneys, where it's all made, down to the bladder for storage. Sounds simple, but it's totally crucial. All right, so this is where the plot thickens. You see, the ureter is built for flow, not for fights. But what happens when it's constantly getting beat up? This is the whole problem of chronic irritation. It's a persistent stress that kicks off this whole cascade of crazy reactions. So what's at the root of all this trouble? It's chronic inflammation. Now, think about it like this. Normal inflammation is like your body's fire department rushing in to put out a small fire. Quick and effective. But chronic inflammation, that's when the fire alarm gets stuck on, and the emergency response itself starts doing more harm than good. So what's actually causing this constant irritation? Well, you're looking at the two main culprits right here. On one side, you've got kidney stones, these hard, sometimes sharp mineral deposits that are literally scraping and blocking the ureter. And on the other side, chronic infections like recurring UTIs that just keep that lining under constant attack from bacteria. Both of these keep that internal fire alarm blaring nonstop. Okay, so when it's under this constant attack, the ureter cells have to do something to survive, right? They have to adapt. And the way they adapt, well, it can get pretty weird, leading to some really strange but sometimes effective defense mechanisms. Let's start with this first one, ureteritis cystica. Probably the easiest way to picture this is to imagine the inner wall of the ureter kind of breaking out in these tiny, fluid-filled blisters. It's the wall's direct reaction to being constantly poked and prodded by inflammation. And this isn't just some random thing that happens. It's a direct consequence of that chronic inflammation we were just talking about. And it's especially common in people who are more likely to have those triggers, like diabetics who often have to deal with recurrent urinary tract infections. Okay, so the next defense mechanism is something called leukoplakia. Now, if the last one was like blisters, think of this one as the ureter trying to form a tough, protective callus. The cells literally change their identity. It's a process called squamous metaplasia, basically to become tougher and shield themselves from all that ongoing damage. But here's the thing, and this is absolutely crucial. This is where a defense mechanism starts to get a little risky. While it's trying to protect itself, this change in the cells is actually considered a pre-malignant step. It's a known stepping stone to a specific kind of cancer called squamous cell carcinoma. The shield can actually become a sword. And it can get even more extreme. With something called retroperitoneal fibrosis, the inflammation causes a huge mass of scar tissue to grow around the ureter, not just inside it. The ureter literally gets trapped in what's like a prison of scar tissue that can squeeze it shut and cause a major blockage. What's really wild about this condition is that for about 3/4 of cases, doctors don't even know the exact cause. It's idiopathic, but they do have some clues. On scans, it classically pulls the ureters inward, toward the middle. It's also linked to certain autoimmune disorders, and for whatever reason, we see it more often in men. It's a clue that it's part of a much bigger systemic problem. Oh, and as a quick aside, there's another really rare inflammatory condition called malakoplakia. It's often linked to E. coli infections. And for anyone in medicine, there is one buzzword you have to remember for it: Michaelis-Guttman bodies. They're basically these little calcified, undigested bacteria inside immune cells, the absolute classic sign. And all of this brings us to the climax of our story, what you could call the ultimate betrayal. This is what happens when those defensive cell changes like that callus we talked about go too far. The cells start to rebel, and that adaptation, it becomes a malignancy. When we talk about cancer in the urinary system, so the bladder, the kidneys, the ureters, one type just completely dominates the scene. A full 90% of these cancers are what's known as transitional cell carcinoma, or TCC for short. And this chart, it shows a really simple but powerful rule of thumb. Cancer is most likely to pop up wherever urine hangs out the longest. So the bladder, since it's the main storage tank, is about 100 times more likely to get TCC than the ureter. The ureter is just a transit tube, right? So it gets the least exposure and has the lowest risk. So what actually ups the risk for this? Well, the list is kind of a mix of lifestyle choices, environmental stuff, and medical things. Smoking is a huge one. But so are industrial chemicals like azo dyes, certain chemotherapy drugs, and even toxins you can find in some herbal remedies. And of course, there's our main villain again, chronic irritation from kidney stones. So what about that other cancer type, the squamous cell kind, that leukoplakia can lead to? Well, there's a really easy way to remember its biggest risk factor. Just think of the letter S. A chronic infection with a parasitic worm called schistosomiasis is a major driver for squamous cell carcinoma. S for schistosomiasis, S for squamous. And this all leads to a very real-world challenge for doctors. When they see a growth in the ureter on a scan, how do they know if it's a harmless polyp or a dangerous cancer? Well, there are clues, right? Things like the patient's age, the shape of the growth, whether it moves around or seems fixed in place. But a lot of the time, imaging just isn't enough. The final answer, almost always, requires a biopsy. So after all that, blisters, calluses, scar tissue prisons, and cancer, what is the big takeaway from the ureter's story? Well, it really all comes down to listening to the signals your body is sending you. And here's why all of this really matters. The big picture is that chronic irritation is a warning sign. It's a huge red flag. It forces your body's cells to change just to survive. And those changes, they exist on a spectrum. They can be harmless and adaptive, but they can also progress from benign to precancerous to a full-blown malignancy. You see, this entire journey, from a simple kidney stone all the way to a life-threatening tumor, is a story of cause and effect. It's a powerful reminder that our body is constantly sending out signals when it's under stress. The real question is, are we listening?